Well, today we are going to talk about a topic called vision therapy beyond the eye. So, really, where this came from is we all, from the therapy perspective, um, we work with patients and we see at their progress evaluations that their visual skills are improving. So their convergence is improving, their tracking is improving, and we're seeing that they're able to succeed so much more in the therapy room. But these population of patients, and you guys, I'm sure, are able to recognize as well, we still have those symptoms of headache, dizziness, eye strain, light sensitivity, or just not feeling the same way that you felt before the concussion. And so, what we're talking about is really the neuroscience behind pain and pain management. So, we're going to spend a lot of time today talking about the nervous system and how that plays a role in recovery. And now I always start off with a question. Why do symptoms sometimes persist even when the underlying visual system is getting better? So, really, to answer this, I want to share some concepts from a pain psychologist. Her name is Rachel Zoffness, and she is a pain PhD psychologist researcher that really her work has really changed how I think about symptoms. A lot of what she talks about in this book, Tell Me Where It Hurts, is that pain is a protective output of the brain and nervous system. And so the takeaway here is that pain is not an outcome of damage, damage to your body, damage to your neurosystem. Pain is for survival. So there are many different inputs that will impact how a patient experiences pain. One of those inputs is tissue state. So that's where we talk about like damage, where we talk about like injury. But the other inputs are also expectations, beliefs, fear, stress, prior experience, attention, and just general context. To really illustrate this, I have a few stories that she discusses in her book that I'm going to try to summarize. This one is called The Tale of Two Nails. So, the story here is that there was a construction worker who had been on a job site, and the construction worker jumped off a plank straight onto a 7-inch nail. So, he was in his boots and then his boot lands right on top of a plank, on top of a 7-inch nail coming out of the plank. He was in excruciating pain. They rushed him to the ER immediately, and they immediately pumped him full of pain medication because he was in pain. So they saw that he was in pain. They gave him opioids, fentanyl, anything to help ease the pain. After he was administered the pain medication, because of the pain that he was in, the doctors removed the boot. And what they found was that the nail had actually passed between the space between his toes. So there was no puncture wound, there was no tissue damage, and there was absolutely no blood. So it was kind of a miracle. But the interesting thing about this was that his pain was real. So, how was it that his pain was real, even though there was no tissue damage? So, the way that his nervous system and his brain responded to his boot landing on the nail was to give the body pain. So, that was his danger detector. So, his brain used all available information to decide whether or not to make pain and how much pain, and it decided to make pain. The pain exists to save your life, right? And so the pain was 100% real. It used the knowledge from the dangerous work environment, past pain experiences, injuries, the horror of the construction workers' faces when they saw his boot land on the nail, and it created pain. So pain was 100% there and 100% not related to any damage. And then the second tale is second construction worker. He was at what was considered the most dangerous job ever. He was on a job site using a nail gun, and the nail gun misfires. And when the nail gun misfires, he sees the nail shoot across the room and bury into the wall. But what happens is when the nail shoots across the room into one of the beams, the nail gun ricochets back onto his jaw. And so he does experience pain from the nail gun ricocheting and clocking him in the jaw. And when he sees the nail shoot across the room, he does have some mild jaw pain, a mild toothache, but in his head, he's fine because the nail went the other way. And so he kind of dealt with the jaw pain and toothache and headache and whatnot for about 6 days. And at the end of the 6 days, his wife says, "Hey, you should definitely go to the dentist." So the dentist scans the patient's jaw, and they actually discover a 4-inch nail embedded in his face. So the nail enters the top of his jaw and passes all the way to his frontal lobe. So here is the exact opposite example where the pain is very, very real. Excuse me, the damage is very, very real, but the pain is not as representative of the amount of damage that this individual experienced. So here's another example of pain not being a reflection of how much damage we have in our body. It is a reflection of how our brain is creating meaning with what is happening in our environment. So again, the biggest takeaway is that pain and damage are not the same thing. Since we're a little bit short on time here, I'm gonna just kind of briefly touch upon back pain. I'm not going to get into all the studies here, but essentially, the majority of individuals, so up to about 85%, or 90%, depending on what population you're looking at, of individuals have some sort of like bulging disc or disc degeneration, and most of them don't have back pain. And so what's interesting is that whenever we do find that a patient is complaining of back pain, we'll do the imaging and we'll see that that individual does have some sort of structural abnormality that could be causing the pain. But the other important information to know from this is that the majority of us do have some sort of anatomical issue with our back and don't have back pain. So this is true for a lot of different body parts. So not just back pain, but hip pain, pelvis, jaw, uterus, wrist, knee, neck. Really, the biggest takeaway is that there's correlation, but there's not causation. So we're taught that pain and damage are the same, and that is a really hard relationship to break, especially as we're going through recovery or we're therapists who are working with individuals who are going through recovery. We always want to associate the pain with damage. And so I think one really important mindset shift to practice is really just trying to um, disconnect those two, like decouple that relationship and start to learn that there are other aspects that can really play a role in why we experience pain. And it does not mean that we are experiencing damage to our neurosystem, our visual system, our physical system. There's other aspects playing a role. This is a really cool story that I want to share. 30 years ago, there was a little kid growing up in Jamaica and he loved to run. He was super, super fast. And as he grew, something strange happened to his spine, and it really just kind of developed into this severe S-shaped scoliosis. So he was diagnosed with scoliosis, and it really didn't stop his running. Um, he didn't get surgery and he wasn't in terrible pain. He just kind of kept running. He was faster and faster and faster until he was fast enough to qualify for the Olympics. And by the time he qualified for the Olympics, his body was so twisted and his spine was so abnormal and his body was so asymmetrical that his right leg was much shorter than his left leg. And his left leg could only put down like 14% as much power as the right leg. So this individual, not only won one Olympic gold medal, but he won 8 Olympic gold medals as the fastest runner. So if you guys can guess, it's Usain Bolt, and he still holds the record for the 100, the 200, and the 4 by 100. So here's another example of damage being present, but the pain isn't there. There's a few more stories that I am going to kind of pass through, just for the sake of time. Um, so yeah, I really want to kind of talk through that the common model of injury is that injury equals pain. And so we need to kind of reshift that mindset into the accurate model, which is evaluating the brain is always evaluating danger, and that is what equals pain. And so that evaluation of danger comes from one of the things that it comes from is that the injury, right? The body injury, inflammation, nerve signals, all of that is very real. But like we talked about in the beginning, past experience, memories, beliefs, emotions, expectations, social context, environment, all of that is playing a role in it as well. And so in therapy, one of the big things is really just trying to create a lot of safety with the patient. So I really like this quote here. Curiosity comes out of a sense of safety, rigidity out of being vigilant to threats. So we as patients or we as therapists, if we are constantly trying to create an environment where we are always vigilant to threats, there is no safety there, and healing just does not happen at the same rate. And so, really trying to create that sense of calm and safety is really what's going to help that nervous system heal to decrease the amount of pain that is being experienced. So, is the pain all in my head? Absolutely not. The pain is very, very, very real. But the biggest thing that we really need to take away is that it is not uh, the only output that's causing the pain is not injury. Um, so pain is a protective output of the brain and nervous system. So I know we kind of talked about this, but just really want to reiterate how it's not always tied to injury and nerve damage and tissue damage. So what ends up happening is the brain learns to turn the pain alarm up when there's that sense of danger. And what we need to really do as either patients or therapists is we need to really teach the brain how to turn the alarm down, like how to turn off that alarm. And so a few strategies here, pain education. I think learning what's happening in your brain and really just trying to learn to disconnect that tissue damage and pain are not the same thing is a really, really, really good first step. So if we are working with individuals who have like this kind of constant pain, or if we're working with, or if we are trying to go through our own journey of healing, really just learning when you do experience pain, when you experience headache, light sensitivity, dizziness, whatever it is, like how do we cut that signal that this is not my body in danger, that I'm still safe, and that I'm I don't my brain doesn't need to turn up that alarm. The other thing is going to be um, I put exercise and movement here in vision therapy because what we don't want to do is avoid the activities that we have learned cause pain. So if reading causes pain, going to the grocery store causes pain, driving causes pain, all of that we need to re-assimilate into those environments so our brain learns safety with it. So vision therapy is a strategy that we use, of course, to kind of help reconnect those visual pathways so they are stronger and easier. And then, of course, our body is able to go into these environments without turning that pain alarm up. There's a lot of lifestyle changes that can help maintain that level of calm and safety. So, getting good sleep, improving stress management, exercise can really help with the stress management as well. Um, And then CBT, cognitive behavioral therapy, is also really helpful to help reframe what these symptoms are resonating as, right? And so in cognitive behavioral therapy, a professional therapist is able to kind of help reframe the mindset, and that can also help calm down the nervous system. And just like exercise, movement, vision therapy, gradual exposure kind of falls under that as well. So just want to highlight here two different patient population. Patient A feels safe, understands the symptoms, expects improvement. And then patient B fears the symptoms, believes that the dizziness, pain, headache, light sensitivity means damage, and anticipates worsening. So, as you can imagine, patient A is going to have better success in their program. Um, and then this one right here, pain does not require ongoing damage. Pain is generated by the nervous system. I know I've been kind of harping on this, so we won't spend too much time on this slide. But again, I really just want to highlight that the symptoms are not fake. It's still there. It's just not always caused by ongoing damage. All right, let's see. So this is I'm sure not new news, but post-concussion patients also develop the hypervigilance, the fear of movement, threat monitoring, fear of screens, fear of symptoms, fear of reading. So they think that eye movement equals danger, or reading equals danger. Or that busy environments equals danger, or light equals danger. So we have to kind of cut that tie. And unfortunately, it can really result in a cycle, right? So there's a visual task there. It promotes symptoms, and those symptoms kind of result in the fear of the symptoms. And so what do? We avoid. We avoid that visual task. And so when we avoid, we have reduced exposure. And when there's reduced exposure, we end up having increased sensitivity. So if we are in those environments with the visual task, there's going to be more symptoms. So this is a cycle that has to be broken. So how does vision therapy help? We, again, want to build the visual capacity, reduce the threat perception, increase confidence, and create successful, that's supposed to say exposure. Okay, so a few strategies is really symptom reframing. So this is kind of geared towards like the therapy session, but I think as patients, we can kind of think about this as well. So let's say we get symptoms every time we go into a grocery store. So instead of saying, oh my gosh, I'm going to get symptoms, I'm going to get dizzy, I'm going to get light sensitive as soon as I go in here, maybe we try to reframe it as I'm going to experience some mild symptoms. I am going to have my system challenged. My nervous system is going to be sensitive in this environment, but that does not mean that my system is damaged. That does not mean that my brain is damaged. That just means I'm a little bit sensitive to this environment. So your brain is learning how to stay safe in this environment that typically causes the symptoms. Um, the CBT-based mantras, I think, are so helpful. There's a lot of good research out there that shows that putting pencil to paper can really rewire your system, right? And so some of these are really helpful to, as the patient, to write every day, or as the therapist to have the patient write every day. And really there's like a variety of ways that you can do this, but it's really what resonates with the patient. So an example for dizziness is writing that dizziness does not mean damage. Dizziness just means that my nervous system is sensitive. And writing that every single day can really help reframe and reshift that mindset. So for headaches, the sensation is uncomfortable, but I'm not in danger. This is not dangerous. For visual discomfort, my visual system is adapting and learning, but I am not damaged or in danger. And then for symptom spikes, symptoms are information. It's not injury. It's just giving my brain information that I'm feeling sensitive in this moment or that my nervous system is activated in this moment. So really, the solution is to reset the nervous system, not to assume that there's a threat for injury. Um, Safe exposure. So really the biggest thing here is not avoiding. The patient is already doing that on their own, but really just showing the patient or you, the patient yourself, just learning that a little bit of exposure, which may spike some symptoms, but watching those symptoms go back down is really what teaches the brain that I'm not in danger, that this is not a forever um, scenario for me. This is just my nervous system being activated. So step into that grocery store for 3 to 5 minutes. Give yourself that time to really experience what it feels like, and then remind yourself this is not, I'm not in danger. And then watch those symptoms go back down. And that is what retrains and reteaches your brain that this is not a dangerous situation for me. Language is important. So we don't want to say my brain is messed up, my eyes can't handle this. This is a bad sign. Really just reminding ourselves my nervous system is sensitive right now. We're going to recalibrate it. This is trainable. This is not forever. This is just an in the moment response because my brain is detecting threat, but there's no threat here. So I got to teach my brain that there's no threat here. I know we're kind of running short on time, so let me just kind of go through like 1 or 2 more slides just to allow for any questions. But body work is really helpful. Breathing, a big sigh, grounding. So before therapy, feet on the floor, relaxing your jaw, relaxing your shoulder. This can just really help in the moment if you're activated or if your patient is activated to kind of like slow things down a little bit. Phototherapy is another good technique that can help reset and rebalance the nervous system by looking through these different light filters. Um, EFT tapping is also really helpful. That stands for emotional freedom tapping. We don't have enough time to get through all of that right now, but essentially there's different meridian points where you're tapping your bone, and that helps like resonate inside your body, and it can help with grounding. And you do the EFT tapping as you state a mantra that's supposed to be very grounding and healing. Cold exposure can also be really, really beneficial to kind of shock that like spiral out of your system. It can kind of help you feel a little bit more grounded as well. So yeah, to conclude here, a visual dysfunction can definitely be a driver of symptoms after concussion, but the symptom persistence is often influenced by how the brain and nervous system really interpret those signals. So we really want to both improve the visual function, but also help patients or help ourselves experience visual activity as safe, manageable, and recoverable. When vision rehab and nervous system regulation work together, patients are really able to break that cycle of persistent symptoms much more effectively. So thank you guys. I know we just have a few minutes here, but thank you guys for listening to the presentation. I hope you found it meaningful and helpful.
Yeah.